Hey guys, for discussion 2, I was assigned chapter 8. I chose to discuss question number 4. Should unlicensed assistive personnel be allowed to administer medications, perform intravenous cannulation, and change sterile dressings? So yes and no. UAP should be allowed to change sterile dressings and insert IVs if they receive the appropriate training and supervision of a nurse. In either situation, a nurse should first perform an assessment of that patient. Allowing UAP to perform these interventions will increase time that nurses can spend on tasks requiring more assessment and clinical judgment, such as medication administration. Medication administration should not be performed by unlicensed assistive personnel. On page 115 in our book, Carol Huston talks about many school nurses and the organizations that represent them. They argue that the administration of medications is much more than dispensing a pill, handing a student an inhaler, or giving subcutaneous injections. It requires high-level assessment skills and understanding of drug actions, interactions, and side effects, and the highly developed critical thinking skills needed to intervene when problems occur. In this situation, Huston is referring to medication administration in a school setting, but obviously this would be even truer in a hospital, where patients are acutely ill and require closer monitoring. I agree with this mindset. There are too many aspects to consider for medication administration to be an appropriate task for unlicensed personnel. Moving on to part B, nursingtheory.org describes Florence Nightingale as the mother of modern nursing. She is considered the first nurse theorist because her ideas contributed in developing and shaping nursing practice. Her contributions to the field of nursing led to it being recognized as a formal profession. She set examples for nurses which are still standards in today's practice. CurrentNursing.com describes Nightingale's theory of environment as being used to facilitate the body's reparative process by manipulating client's environment. Her interventions during war were used to provide a clean environment. Carmi and Alvey state that Nightingale used prior math knowledge to predict outcomes. She provided clean equipment, water, and nutrition to injured soldiers. She also made sure that healthcare professionals were clean. By doing this, she was able to decrease the mortality rates by more than 20%. Her theory of environment is still used as a standard of care today. Repeatedly, we learn in nursing school that hand washing is the #1 way to prevent infections. We always wash our hands before and after providing patient care. We know that by decreasing the spread of bacteria and providing a clean environment, we greatly decrease healthcare complications and mortality rates. Numerous studies have been done to show that infection prevention is key to a successful outcome. This further shows that theory and practice are interdependent. Theory provides structure for nursing interventions and suggests outcomes. Our nursing interventions are never done without reason. Maslow's hierarchy of human needs is a non-nursing theory we see integrated into our daily care. CurrentNursing.com describes it as a way to guide prioritization of patient care needs. We often remember seeing this represented as a pyramid with levels. The idea is that needs on one level must be met before moving on to the next level. This non-nursing theory can be represented when nurses are doing a patient's initial admission assessment. Part of our assessment is to ask if the patient feels safe at home and safe with their current partner or in their current relationship. We assess for signs of abuse. This assessment answers questions about safety needs, which is the second level of the pyramid. I am curious to see what your responses to this discussion. Hope you guys have a good day.